everyone, welcome back to another episode. This is episode 6, and today I'm going to be talking about the stigma on medicine, because a lot of people have a lot to say about that. But a lot of people have negative attitudes and stereotypes on medicine, thinking that is just all in their head. Duh. What do you think the problem is? And mental health disorders are often judged as weaknesses rather than thinking medically. I'm reading from my notes, by the way, as usual, because I can't remember things. Depression. Also, I got my hair done. Super short. And then shout out to my mom for this sweatshirt. It says God is good, and then on the sleeve it says all the time. Period. Anyways, the stigma towards certain treatments, the use of psychiatric medications can be thought of as unnatural and lazy. When I first got diagnosed with bipolar, some people in the family said just pray and you don't need that medicine stuff. And I'm like, yeah, kind of need it. Because they don't really know like what it's like. They have some mental health issues too, but they don't acknowledge it, which makes them not understand the concept of medicine and how it truly does help. My hair is uneven. It's bothering me. Anyways, it can be thought of as unnatural and lazy, compared to therapy and pain management. It can sometimes be seen as suspicious even when it could be necessary. Like, my mom has issues with her back, so she has to take pain medicine. But some people do abuse pain medicine. They like the feeling it gives them, and they get greedy and want more. And that's how addiction turns out. Fun. She only takes it when she's in pain, not, before the pain starts. That's how addiction kind of starts. To me. Okay. And the impact on patients. When someone is trying to seek help, they can avoid it or delay trying to get help because of the fear and judgment that they may face. When I first started having relationships and like talking to people and like talking stages, way back when, I would keep my mental health issues silent. I wouldn't tell them. And then I did tell one person that I was talking to, and he literally said, I don't know about all that. And I was like, okay. And I blocked him. Like, I chose to tell you, like, what I have going on, and you're just like, well, I don't know if I can handle that, but I want to get to know you. What? Men. I hate men. Reducing the stigma. More education would definitely help, along with awareness campaigns. I don't think mental health is talked about enough. People think it's like something personal and that it shouldn't be shared. I mean, yeah, if you don't want to like tell your story or talk about your mental health, that's fine. But for people to use that as an excuse to, not support you, that would be terrible. And I think awareness is necessary because, maybe your daughter or your son later down the line gets a mental health disorder and you won't know anything until you actually do research and you're like, oh no, like, why didn't I know this? Like, I could have prevented this from getting worse. You know what I mean? The stigma in society around medication shows up when health conditions or treatments are judged due to cultural beliefs or values rather than medical facts. So, let me read this again. Oh. Also got cherry coke. Who would have thought? Some cultures don't believe in medicine. They believe in like meditating or praying or doing rituals or something like that. Like, I don't know, some witchcraft stuff maybe. I don't like that stuff. Witchcraft is cray cray. I used to be obsessed with horoscopes. I'm a Sagittarius. But every day in high school, I would check my freaking horoscope that I have had on an app, and it would be like exactly what happened. And I was like, this is freaky. And I was obsessed with astrology, and I'm like, I hate Geminis. I hate Scorpios. Yeah. Where how did this come to topic? Why? I lost my train of thought. See? Depression. Depression. Maybe I have ADHD. I don't think so. No. Look at me trying to diagnose myself. But yeah, cultural beliefs, they can really mess with your mind a little bit, in my opinion, because, you know, your family or your God or whatever it is, they will be against it, and you won't actually be able to get help because you don't want to disappoint them, or you don't want to go against your culture. Sorry, my best friend texts me. Usually when you get diagnosed, you are also told to try therapy too. I do therapy and I take medication. I don't take any narcotics or anything. So I don't have to worry about that. But I don't like relying on medicine. Some people don't either. But it does truly help if you do seriously need it, and I seriously need it. Because without it, I probably wouldn't be here right now. That's how bad it is. Without medicine, I am suicidal. I'm depressed. I'm depressed. And I go off the wall. So, yeah. Yeah. He was a fairy. I keep saying that. I don't know why. Yup. He was a fairy. I don't know. Something's wrong with me. Oh my lord. It can affect not by. Can I not English? It can affect how people are treated socially, but also deciding to seek help in the first place. It's really hard to reach out if you're, 1, scared, 2, don't want to be judged, 3, you have fears about what you're actually dealing with. I don't want to say like what's wrong with you, because nothing is wrong with anybody. And I don't like labeling people like, oh, there's something wrong with him. No. Like, if someone was to say, what's wrong with Chase? You better back up. No, I'm just playing. No, but I would be like, there's nothing wrong with him. He's perfect. He's normal, just like you and me. I don't see disabilities as something bad. I treat everyone equally, and that's how it should be. People are people. You have to be nice to people if you want them to be nice to you. Sometimes it's not always like that, though. Some people are mean. And I've been having freaking anxiety so bad for the past 2 days because, 1, the kids are back to school as of yesterday, the 13th. Today's the 14th, 2025. And I'm scared about bullies, like people bullying Chase. Like Callie, she can hold her own. She will like stick up for herself. She does stick up for Chase too, but they're not in the same grade or anything, and they don't really see each other. I'm having anxiety about people bullying Chase. My Chase. I don't like that. And then I'm also thinking about school shootings. Nope, nope, nope. I feel like crying right now because I'm so scared. Like, I'm seriously trying to fight off tears right now. Because, well, I don't want to give their location away. But let's just say there's a store about pew pews, you know, the GUN, by their school. And what if some cray cray person goes in there, gets some, and then goes to the escuela, school, if that's right, in Spanish. And that just freaks me out. Luckily, they do have, what's his name? This officer there. I don't want to say his name. But I remember it. But I don't want to say his name. But he's there. When I drop them off sometimes, like last year, when I dropped them off there in the morning, he was there. So I think he stays all day. Because when I do go and pick the kids up from school, he's there. So I think he's there all day, which makes me feel a little better. But there's only one of him. My eyes just twitched. Oh my goodness. It's stressing me out. Oh my gosh. Oh my gosh. Anyways, yeah, so I'm having anxiety over that. Cool. Yeah. Anyways, how the stigma takes shape in society. Fun. People are labeled to reduce the person's diagnosis, like, she's bipolar, he's an addict. Like, making it seem like a bad thing. Like, being bipolar is not a bad thing. I mean, it's unfortunate and it sucks. It really does suck. But, you know, being labeled really sucks. 'Cause, like, before I got diagnosed with bipolar, I was always scared of people who were schizophrenic because of all the stereotypes and all the things that I've heard and all the movies that are out. Like, what's that movie where there's one guy, he's bald, and he has a bunch of different personalities? And I know one of them is Patricia. Let me look. Movie with Patricia. What's the movie called? Split. Yeah, it's called Split. And let's see. Patricia is a character, specifically one of the personalities of Kevin Wandle-Crumb, portrayed by James McAvey in the movie Split. Maybe that's just split personality. Maybe it's personality disorder. Maybe I'm thinking of something else. But anyways, I still like would hear things about people with schizophrenia, and I'd be scared of them. But now, learning more about mental health, I don't view it that way. I'm like, oh, okay, like, they realize like what's going on. They're trying to get themselves better. Some people don't end up getting help, and that really hurts them in the long run. My earrings are down there. I thought I had my earrings in. See, off topic. ADHD? No, just fine. Here we go. Shaming and blaming. The person's illness is seen as lazy or a result in poor choices. Like, you know, When I got diagnosed with bipolar, uh, before I was very bad with choices. Uh, and I was lazy. But that was before I got diagnosed. And then I was like, oh, okay. So some family members were like, oh, she just needs therapy, or she just needs to pray more. She needs to motivate herself, take some vitamins. Vitamins don't fix everything. Praying, I love praying, but I don't I don't know. Like, I don't know. I don't know how to say it, so I'm not going to say it. Many people who have mental disorders may try to keep their diagnosis a secret, like I did. Now I'm vocal about it. Due to being judged and people acting different around the person with mental health issues. So like I said, I think I was around someone with schizophrenia once, and I did act different around them because I didn't like want to trigger them or something. Like, I never knew how it worked. But I was acting different. Yeah. So that makes me upset that I did that, because they are literally a normal person. They just have struggles. The effects it has on people: they may isolate, depression, have a self stigma, and delay care due to fear and judgment from others, like I said before. I would isolate myself. I would drink a lot underage. Sorry, Mom. I know you're watching. Love you. But I isolated. I didn't talk to anyone. I would talk to a bunch of people and then ghost them, do my own thing, cry, feel bad about myself, feeling ugly, feeling fat, feeling skinny, too skinny. Because I was like 90 pounds. I had a flat stomach. I miss those days. Why? But anyways. People who have diabetes need medicine, just like someone with anxiety, depression, or bipolar, like me, which is what I told in my episode of Hello, I'm Bipolar. If someone with diabetes didn't have medicine, things would end badly, and the same goes for people with mental health issues. It's honestly no different because it stabilizes the brain, and for diabetes, the body. Medications aren't fix-alls. They work best with counseling/therapy. Some don't believe in those. At first, I didn't, because I'm in therapy and I've learned new coping skills. I still have anxiety. That's always going to be there. Some don't believe in those. At first, I didn't, once again, because I thought, talking to someone about my issues was stupid, because I have a mom and she knows everything. To me, she knows everything. She's always right about things. But I'm always right about some things too. We gotta listen to each other. But I've learned new coping skills for my anxiety. I met with my therapist last week, and I see her every 2 weeks. I met with her last week, and I mentioned my anxiety was really bad, and then she said to put cold air in my face when I'm having an anxiety attack, drink cold water, something else. But I told her when I have anxiety, it's usually like when it's getting, downtime, like going to bed. I have bad anxiety. Probably because like the day is over with and I finally relaxing. My brain is starting to slow down, and then like it starts thinking about one specific thing, and then it goes, and then I start having anxiety. Like last night, I had the worst anxiety attack of my life. I thought I was gonna throw up. It was that bad. Oh my gosh. I literally counted to 100 twice, and that seemed to help. I would count it fast, and that would help a little bit. Then I started watching Karens get arrested. I love watching that now. If King Wools doesn't post a video, I watch Karens get arrested. I watched a 3-hour video of Karens getting arrested. I loved it. I really did. It was fun. I like it. They're so stupid. I'm gonna sue. We both know you're not, but okay. Anyways, I met with my therapist last week, and we talked about coping skills, and it's a good way to improve the quality of your life. I see that now. And there's also stigma on doctors just handing out medications to patients. I will say there are some sketchy doctors. You know, be like, oh, here. Like when I was younger, we would go to the doctor, this family doctor. What was his name? I don't know. But he had a nice car, and his handwriting sucked. But we would go there. I would say I was sick with something, and then he'd just automatically give me medicine. Didn't even like check me out or anything. He did that like every single time. Like a nurse would come in and check my vitals and all that stuff, and like look at my throat, look at my ears, listen to my heart, my lungs. And then he would come in and be like, oh, okay, here you go. Hello? So yeah, we definitely don't go to him anymore. I don't even know if he's still a doctor. Hope he's doing good though. But anyways, real deal doctors don't just throw out medicine. They run tests. They do swabs. That's what I did, to see like what medicine would work for me. Like I did this before I got put on medicine. I did this test. Well, I had a questionnaire with Dr. Gambino, and then she made the diagnosis of me being bipolar. But before she prescribed me medicine, she had me go to therapy, start therapy first, and then brain fart. Oh, I got a test in the mail. I swabbed my cheek and had saliva. Gross. And then I sent it back. And that kit, that testing kit, was to show how I would react with certain medications. Like they would take my saliva and then put it with different medicines, and it'll show up sorry. It'll show up green or red. Green for good, red for bad. Duh. And I had a lot of red, and only certain medications worked for me. But I think we still tried them anyways, just to see. But now I finally have the medicine that works for me. Yeah. Anyways, I did do other tests like blood tests and stuff like that, urine. It helped a lot with the diagnosis, like to confirm it. And it can take months or years to find the right medications. For me, it took from 2021 to last year, 2024. That's how long it took me to finally have the medications that stabilize my bipolar, depression, anxiety, and mania. Period. Thank you, Dr. Gambino. But like I said, I still struggle with anxiety, but that's literally the only thing that is creeping up on me again. And like, sorry, my head keeps itching. Nervous? Stopping medication. A lot of people may stop medication because of the side effects such as gaining weight quickly. I experienced that issue. That's why I've gained weight. Because I was on medicine called Remeron, or like mirtazapine. That's another name for it. Mirtazapine. And I was up to 150 to 160 after being like 105, 110 my whole life. And that's the most I've ever weighed. And now, like I said, I'm maybe 146, 130 something. I don't know. Go get your checkup. Go get your flu shots. If you don't believe in shots, take vitamins. I don't know. It won't always help. Vitamins aren't the answer for everything. Also, my eyes are so bad. I'm trying to see how long this video has been. I'm not even going to. Anyways, we're about to end anyways. There are substance use disorders like addiction. Yeah. I know about that all too well. Not me, not my mom, not my sister, not my brother, not my other sister. My father, dad. He's an addict, severe addict, and we're going to discuss that on next week's episode. It's going to be called Daddy Issues. You will definitely want to tune into that one. So, take the day off. Go, to work. Go on your lunch break and watch a video. Like and subscribe. And share. Share. I checked my, what is it called? Analytics? I can't. Let's go on YouTube right now. King Wolves posted a video yesterday I gotta watch. Let me see. Oh, here it is. Also, I hit 40 subscribers, so thank you so much for watching, and thank you for all the support I've gotten. What is it called? Analytics. I have 17 shares, 5 comments, 43 likes, and 655 views. That's insane. And I have had 37 views in the last 7 days. Can you see it? Yeah. Yep. And go watch What It's Like to Have a Brother with Special Needs. That was episode 5. So definitely go watch that. My little brother was in it. He's the best. He's the cutest. Anyways, yes, there are substance use disorders. There is evidence based on treatments, medication-assisted treatments, and medications for alcohol use disorders. People who are addicts probably did need medication at one point, but things turned sideways, and they missed the feeling and overused. Have I even taken a drink of my cherry Coke right now? I mean, since I started? Hold on. I hope you guys heard that sizzle. Ooh, delicious. I love cherry Coke. I want to inject it in my veins. Anyways, all in all, medications are necessary in mental health diagnoses. Many voice their opinions on taking medications. Some say pray or take vitamins or try natural remedies or, meditate, go to the gym, eat healthier. Come on. It just doesn't work like that. And with that being said, I will end here. And I hope you enjoyed watching this video. Please like and subscribe. And stay tuned for next week's video. You will not want to miss it. It's going to be a good one, I think. Might be kind of long. So, prepare yourself, get a snack, get a drink, do what you gotta do. And I will see you guys on the next one. Peace.